Hi, you guys. Welcome back for our daily practice questions. It is day 76, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, you guys, if you are looking to join my 5-week intensive review, I still have one spot remaining. Grab it while it is still available. All right, question number one. A 34-year-old woman presents to the clinic with sudden onset unilateral facial weakness on the right side of her face. She reports difficulty closing her right eye and smiling on that side. She denies any pain, fever, or recent viral illnesses. Neurological examination reveals no other deficits, and her symptoms are isolated to the facial muscles. Based on this clinical presentation, what is the most likely diagnosis? Is it A, temporal arteritis, B, stroke, C, Bell's palsy, or D, migraine with an aura? Take a moment and tell me what you got in the comments, y'all. All right, all right. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So, here the stem of the question states, based on this clinical presentation, what is the most likely diagnosis? And y'all know I always tell y'all, if they're asking for a diagnosis, you have to run it back and look at those assessment findings. What are their signs and symptoms? How are they presenting? What is their chief complaint? What is noted on exam, right? So here we have a 34-year-old female who comes into the office with sudden onset of unilateral facial weakness on the right side of her face. And she's reporting difficulty closing her right eye and smiling on that side. She denies any pain, fever, any recent viral illnesses. Neuro exam shows no other deficits, and all of her symptoms are isolated just to those facial muscles. Y'all, this is classic for C, Bell's palsy. That facial weakness. When I say facial weakness, you say Bell's palsy. Now, can there be other diagnoses that you can consider in your differential, like a stroke? Yes. But where it says neural exam reveals no other deficits, it's not common that it is all just generalized to the face. When they are specifically honing in on facial muscles in these exam questions, this is for board's purposes. I want you to think Bell's palsy, okay? All right, question number two. What is the most common initial treatment approach for a patient diagnosed with Bell's palsy? Is it A, oral corticosteroids and antivirals? Is it B, oral ibuprofen? Is it C, physical therapy? Or is it D, Botox injections? Take a moment and tell me what you got. All right, so here in this scenario, the question is the stem is the question, right? So it states, what is the most common initial treatment approach for a patient diagnosed with Bell's palsy? So how do we treat Bell's palsy? And your best answer is A, you guys. So we're going to go with our oral corticosteroids and those antivirals. We start off hitting them with the oral corticosteroids to help reduce that inflammation, which often helps significantly. And then we get antivirals on board. The sooner, the better with the treatment for Bell's palsy. And then lastly, question number three, which cranial nerve is primarily affected in Bell's palsy? Is it A, cranial nerve 1? Is it B, cranial nerve 7? Is it C, cranial nerve 10? Or is it D, cranial nerve number 2? Take a moment and tell me what you got. All right, all right. So here again, the stem is the question is the stem, and it states which cranial nerve is primarily affected in Bell's palsy. Remember those common diagnoses associated with certain cranial nerves. So when you think Bell's palsy, you should think cranial nerve 7, right? So the best answer is B. And know your Roman numerals because they will give you the Roman numeral on the exam. If you don't know it, don't miss it because you don't know the Roman numeral, right? So cranial nerve 7 affects that facial nerve. And you know with Bell's palsy, it is that facial paralysis, unilateral facial weakness and paralysis that is associated with it, right? So again, it is B, cranial nerve 7. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one, at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And as always, if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.